plus 3 zeros. I'm ready when you are. Yes. You got me on.
We put our district number and then 4 zeros. We're getting too damn technical.
It's just a house. It's just a house. Good morning. I believe we are ready to start the Subcommittee of Government Operations. We are the Education, Health, and General Welfare Committee. We will call us to order on June 17th, 2025. Madam Clerk, would you please take the roll?
Senator Crow is present. Senator Jackson is present. Senator Oliver. Senator Seal is present. Senator Sutherland is present. Chairman Rose is present. Representative Crawford is present. Representative Glenn is present. Representative Hilton Haynes is present. Representative Rutter is present. Representative McKenzie is present. Vice Chair Fritz is present. Chairman Rose, we have 11 present.
We have a quorum.
You can operate yours.
Well, there you go. I can operate mine, so y'all hang on. We'll find out if I can do this or not. All right, before we get started, are there any personal orders from our panel? All right, seeing none, let me just make an announcement. Remind the members and the audience and those listening online that what we can do today as a joint committee, we can extend the entities that we're going to be hearing from by 1 to 8 years. We can terminate them, which would put them in a 1-year wind down. We can restructure the entity, or we can make no recommendation. Our recommendations will be drafted into individual sunset bills that will be heard during full committee in the 2026 legislative session. There's also a public comment sheet at the front table, and if anyone in the audience would like to sign up, please do so, and you'll be recognized at the appropriate time. No questions. Let's get started with item number 1. We do have 16 or 17 items today, so we'll try to move expeditiously because we have another meeting shortly after lunch today. Right now, we're going to recognize the Department of Disability and Aging. They're item 1 and 2 on our agenda, and if you would, I think you all know what you need to do. Make sure your mic's on. The red light should be on. I think you're being controlled up here, but identify yourself, who you're with, and you are ready to present.
Yes,
Go
sir. Thank you, Mr. Chairman. Good to be here. My name is Brad Turner. I am the commissioner for the Tennessee Department of Disability and Aging. To my left is Deputy Commissioner Andy Kidd on our fiscal side, and to his immediate left is Jordan Allen, my Deputy Commissioner for Operations. Certainly appreciate being here and the opportunity to share our story.
Let's go ahead.
So just a brief history. I think most of you know, because you were involved in it, that our department, formerly the Department of Intellectual and Developmental Disabilities, was merged with the Commission on Aging. We are now the Department of Disability and Aging, which was established by this body last summer. Certainly appreciate the opportunity to do that. We have seen a lot of very successful things happen as a result of that. Conversations both in the disability community and in the aging community. I think our sole thing is to make sure that Tennesseans in both of those communities have the ability to live independently and continue to live where they want to live and do the things that they want to do. All the things that we take for granted that sometimes we forget about, we've been able to do that. So we're working very closely with our area agencies on aging and disability, other state departments, to continue to make sure that we're streamlining resources, services, and getting folks in touch with people that might be able to give them some assistance. So I'm happy to say that we're doing that. We obviously have a lot of work to do, and that's the goal, is to continue to make sure that we become as efficient as possible. But I believe that the story is telling itself. We're helping more Tennesseans than ever before. And when I say we're helping more Tennesseans than ever before, it's not necessarily the idea that government is helping them. We're actually giving them opportunities to pursue things that they've not been able to do. That we just happen to be a lever that they can pull. So really excited about the things that we're doing. Very proud of my team, very proud of our department. Appreciate the support from this body, both the House and the Senate. Funding is incredibly important, and we have had that. Your partnership is incredibly important. important that we have had that. And so for us to continue to move Tennessee forward, we're going to continue to need to work together. And I'm confident that we're going to be able to do that. One of the I think, key bits of data and information for you, and I see Senator Crow and Senator Watson and some of the others here that are representing these areas. The fastest growing area in the entire South for those who are retiring is actually East Tennessee, moving up from Hamilton County, Polk County, Carter County, Unicoi, the Appalachian area. So we have a lot of opportunities to make sure that we continue to support people, and I'm proud to say that we're doing that, and we're going to continue to do that as we move forward. So happy to answer any questions.
All right, thank you, Commissioner Turner. Are there any questions from our panel? All right, Representative French, you are recognized.
Thank you, Mr. Chairman. Thank you, Commissioner, for your time today. My question's moving over into the 2023 resource map on page 3, if that's helpful for you. And I think it's great work. I'm just trying not to speculate on what number of older adults served. We've got 2.5 million, and help me understand how that number is derived. I couldn't find in here how we arrived at that.
Yes. I'm going to let Deputy Commissioner Kidd also walk you through that, but that's obviously going to be a number of the demographic, but there's a little bit deeper detail, Representative Fritz, I think you're looking for. So Andy will be able to answer those questions.
Yes, Representative. So we do surveys and then also look at census data. So census data is one of the main areas that we get that from. Obviously, we only do census so often, so some of that is derived estimations, but we can provide you with kind of the back end detail of how we get those reports, but we gather multiple reports to come up with that number.
Just one follow-up. Thank you, Mr. Chairman. So when above 62, I think in Tennessee, I got like 1.7 million people. And so that delta between the 2.5 and the 1.7 raised the question for me. So that's something we can talk offline. I don't want to take much of your time with it today. I'd like to follow up on that.
All right, thank you, Representative Fritz. Appreciate that question and response. Any further questions? All right, any questions, comments from the audience? All right, don't see any, seeing none. Do we have a motion? Representative Crawford.
Thank you, Mr. Chairman. I'll make a motion for a 2-year extension into 2028.
All right, you have a motion. Do we have a second? Got a second? All right. Any objection to the vote? Seeing none. Madam Clerk, please take the roll call vote in the Senate.
Senator Crow? Votes yes. Senator Jackson? Votes yes. Senator Oliver? Senator Seal? Votes yes. Senator Sutherland? Votes yes. Chairman Rose?
Aye.
Votes yes.
All right, thank you. If you will, we have a majority there in the Senate. Would you take a voice vote in the House, please, for a 2-year extension? All in favor, please say aye. Opposed? Seeing none. Moves forward with 2-year extension. I will get this going correctly here in a minute. As soon as the folks on either side of me keep me straight here. All right, you are the next item on the agenda. Commissioner Turner, go ahead.
What was the next item? I didn't see it. The Commission on Aging. Yeah, I'm sorry. I did not see that in front of me, Chairman. I apologize. So our Commission on Aging, again, this is something that's been around for several decades that was established to better support Tennesseans who are in the aging space. Incredibly important work that they've done. There are some legacy folks that have been engaged in this space for quite a long time, but there has been an incredibly strong benefit for Tennessee. I appreciate the leadership of a lot of the folks that served before I had the privilege to do that, and they have actually set a really good foundation for us. We've got my Assistant Commissioner for Aging, Lauren Legate, is also here behind me doing a great job working with those entities and the folks that have been engaged in that. So again, Mr. Chairman, happy to answer any questions, but very confident and very proud of the work that has been done from the Commission.
All right, thank you, Commissioner. We have any questions from our panel? Representative Fritz, you're recognized.
Thank you, Mr. Chairman. I promise I'm not going to question us to death. This is just a comment. Overlooking at the folks that serve on the board, we've got Mayor Terry Frank listed, and it lists her from Knox County. And of course, she's Anderson County. I don't know if that's just a logistics thing or if it was, okay. All right.
So thank you, sir.
Thank you.
That's good attention to detail there, Representative. All right. Chairman Crow, you're recognized.
Thank you. I do want to just, as chairman of the Health and Welfare Committee, they come before us for their budget. And I just want to tell you what a great job they are doing out there, especially in having brought to the department the aging division. And just want to thank them for what they're doing. I've seen them out in the communities, and I know the heart they have. And with the dollars they have, they're doing a great job, and we appreciate that.
All right. Any further questions or comments? All right. Seeing none, any from the audience? All right. Seeing none, do we have a motion? Chairman Jackson?
Thank you, Mr. Chairman, and I make a motion for a 4-year extension for until 2031.
All right. We have a
I mean,
motion for your
I'm sorry,
extension.
Yeah, 4-year extension until
extension.
2030.
Okay. Thank you, Chairman. Do we have a second? Second. Got several second. All right. So no objection. We'll take a vote. Madam Clerk, please take roll call vote in the Senate.
Senator Crowe votes aye. Senator Jackson votes aye. Senator Oliver, Senator Seal votes aye. Senator Sutherland votes aye. Chairman Rose
Aye.
votes aye. 5 ayes.
All right. All right. We'll take a vote, voice vote in the House. All in favor, please say aye. Aye. And opposed? Moves forward a 4-year extension. Mr. Turner, thank you so much for what you do and your panel for being here today. And you are appreciated. I wonder, though, if most of us in the Senate need to declare Rule 13. We voted on this. I'm not sure. Most of us. Thank you again. All right. The next item on our order today is the Council on Autism Spectrum Disorder. I think you already know what you need to do, but please state your name, who you're with, and you will make your presentation.
And forgive me, is this working? Okay, appreciate it. My name is Seth Wilson. I'm Senior Associate Counsel for Department of Disability and Aging. Very grateful to be able to work with the Council on Autism Spectrum Disorder. To my left is Jenna Martin. She's the Director of Disability Services and our liaison to that council. Andy Kidd, already introduced previously, Deputy Commissioner of Fiscal and Administrative Services. And to my right, Trey Jones, our Legislative Director. The council was created in 2017 in April, Autism Awareness Month. It's made up of 18 total members, and 9 of them are family members or persons with a diagnosis of autism spectrum disorder, along with 9 representatives from agencies all across the state. The purpose is outlined in statute, make recommendations, and provide leadership and program development regarding matters concerning all levels of autism spectrum disorder services. That's done through the council's quarterly meetings, along with committees that have been created by the council themselves to further that purpose. Recent great work from the council includes working with multiple Tennessee autism advocacy groups across the state to develop a survey for healthcare providers to understand barriers in providing services to people with autism. Working with departments of commerce and insurance and health to make statewide recommendations for training on crisis situations involving people on the spectrum. Creating an annual Pat Edmiston Award, recognize Tennesseans, improving the lives of fellow Tennesseans across the state diagnosed with autism. And working annually, got to give a shout out to our communications team. I know our Assistant Commissioner, Carrie Kamari's in the room right now, producing videos and short stories highlighting Tennesseans with autism. The creation of the council had long been desired by advocates and people with autism and their families across the state. Recent data showed that 1 in 29 children born in Tennessee received a diagnosis of autism spectrum disorder. That was 2022 from the Tennessee Autism Developmental Disabilities Monitoring Network. The council provides a voice for those individuals and their families. Accordingly, we respectfully request the council to be extended in order to continue its legislative mandate. And of course, we welcome any questions and appreciate the opportunity to come before you today.
All right. Thank you so much for your presentation. Any questions from our panel? Yes, sir. Representative Glenn.
Thank you, Mr. Chairman, and thank you all for being here. Quick question: how difficult is it to get someone registered or under your purview in the autism side of what you do?
Great question. So we have a couple of different
If you
avenues.
don't mind, tell
Yeah,
us who
sorry,
you
Andy
are.
Kidd, Deputy Commissioner of Fiscal and
Thank you, sir.
Administrative
Appreciate
Services
it.
for DDA. For DDA, there's a couple different avenues in which they can come into our programs, depending on their age. We have our Tennessee Early Intervention System, which begins at birth through their 5th birthday. That's typically where we receive a referral for children that there's a suspected autism diagnosis. And so they're referred through that, found eligible, and if eligible, they're able to receive services at no cost to families. That's by and large where we typically see folks referred from.
Go ahead.
Thank you, Mr. Now, you said from birth till about 5. So after 5 years old, do they come out of the program, or do you have a different program that they stay in until 18 or something to that effect?
They're then eligible to move into the Department of Education special education system through their local school districts. And then we also have our Katie Beckett program that they're also eligible for through the Department of Disability and Aging. So there's actually 2 different programs they're still eligible for at that point.
All right, thank you. Any further questions from our panel? All right, any from our audience? All right, seeing none, no objection to the vote. Madam Clerk? Oop. Oh, I thought I did that. Public comment? All right, seeing none. Madam Clerk, would you take the roll call vote in the Senate? Oh, got to have a motion, excuse me. Chairman Crawford.
Thank you, Mr. Chairman. I make a recommendation or a motion for a 5-year extension for into 2031.
Thank you, Rep. Do we have a second? A second? All right. No. Okay, no objection to the vote. Madam Clerk, please take the roll call vote in the Senate.
Senator Crowe votes aye. Senator Jackson votes aye. Senator Oliver, Senator Seal votes aye. Senator Sutherland votes aye. Chairman Rose
Aye.
votes aye.
All right, all those in favor in the House, please say aye. And opposed? Seeing none, moves forward with a 5-year extension. Thank you so much. Appreciate you being here. Next item on our agenda is the Board of Communication Disorders and Sciences. Chairman Watson, you want to let him present? Good morning. Ms. Putnam, if you would tell us who you are and who you're with, and you may proceed.
Good morning, Chairman and members. My name is Holt Wood. I'm Assistant Commissioner for the Department of Health. I'm joined by Jennifer Putnam, who serves as Assistant Commissioner for Health Licensure and Regulation of the Department of Health. Jennifer and I will be presenting on the next 10 agenda items. We also have some fiscal staff in the audience as well if we need to call someone up for some specific questions. For this board, we're also joined by Michael Varnell, who serves as the advisory attorney. I'll turn it over to Jennifer for further explanation.
Thank you. Good morning. This board was established in 1973 to regulate the practice of speech pathology and audiology. Currently, there are approximately 4,500 professionals that are licensed by this board. In addition to issuing those licenses, this board also promulgates rules, investigates complaints, and handles disciplinary matters. The board has 7 members, all of which are appointed by the governor, and they meet 6 times a year. Currently, there is 1 vacancy and 2 positions that have expired, with those members continuing to serve until a successor is appointed. Those positions are currently in the appointment process to be filled by the governor. This board is self-sufficient, and we're happy to answer any questions you may have.
All right, thank you. Any questions from our panel? Chairman Watson, you are recognized.
Thank you, Mr. Chairman and members. And Chairman, thank you for the indulgence. I'm pulled my government operations alumni card today because I'm working on some legislation relative to speech and language pathology for the next session. And I thought this would be a good opportunity to at least do some exploratory. To the members of the committee, I may ask a few detailed questions that may not be you may not be familiar with, but I work as a physical therapist. I work alongside speech and language pathologists, and we often speak the same language clinically. So to the panel and for the committee's purposes, can you explain the need for members, speech and language pathologists, when they first graduate with their master's degree from a program, they are required to pay the American Speech and Hearing Association to provide them with a certificate, which is known as a certificate of clinical competency after a 9-month provisional period. This is a legacy program that extends back probably prior to when states began issuing speech and language pathology licenses. So in the current law that we have in Tennessee, is a speech language pathologist who has graduated from an accredited program required to get a provisional license through the, I would assume, through the American Speech and Hearing Association, ASHA.
Thank you, Chairman Watson, for the question. I appreciate the conversation yesterday. The path for licensure does require that they hold a certification from ASHA or holds a Doctor of Audiology degree from an accredited institution of higher learning and has passed the examination required for licensure.
And to the members, here's why this has become an issue. It's been an issue actually for quite a while among speech and language pathologists because they're basically paying for 2 licenses. They pay the state of Tennessee, which is truly the body which determines whether they have met the standards for practicing speech and language pathology. And then they pay a proprietary private entity, which is the American Speech and Hearing Association, for yet another certificate to practice something that the state of Tennessee has said they're already licensed to practice. This has become an issue because in recent Medicare rules and regulations, Medicare has said they will no longer acknowledge the provisional license and will not reimburse entities under Part B that are using provisional licenses. And so it begs the question whether this whole CCC is what speech and language pathologists call it, whether this whole certificate of clinical competency is even relevant now that the state of Tennessee provides licensure on that. That's a little bit of background for the members. Does the state, once a person has, and I wish a board member was here because it would make that they would have more detailed questions, so I'll have to ask it another time. But does an individual who, after graduating from the school, from a accredited program licensed by the state of Tennessee, completes the 9-month residency/fellowship program that's required under the provisional licensure, once they have accomplished that, does a person continue to have to pay the $250 to ASHA for maintaining what the speech pathologists call their CCC?
Thank you for the question, Chairman. That is not a requirement for renewal for their licensure.
Do you have any idea what the impact that is on the clinicians who may elect not to pay ASHA for their continued clinical competence, even though that's already been determined by both the state as well as the provisional license? My understanding among the speech and language pathology community is that they are afraid that their ability to practice clinically will be impeded if they do not continue to pay ASHA for the CCC. Do you have any information on that? Have you heard anything about that?
No, sir, I haven't. I could just confirm that it's not a requirement for renewal at the board.
Okay. And then I won't belabor the committee. Again, Mr. Chairman, I appreciate your indulgence. Medicare defines qualified speech language pathologist as someone licensed or certified by the state to provide therapy services. They do not recognize the CCC as a requirement to practice as a speech language pathologist. And the legislation that I'm looking at, and Mr. Witt and I have discussed this, the legislation I'm looking at to the members of this committee is that we eliminate the requirement of the CCC because it seems to be in the modern world of speech language pathology and with state offering licensure that it is a legacy of the past that no longer really needs to be continued. With that, I'm open to any questions that the panel might have of me or further.
All right. Thank you, Chairman Watson, for those questions to the panel. Any questions to either Chairman Watson or to the panel before us? Rep. Fritz, you are recognized.
Thank you, Mr. Chairman. Mine's for Senator Watson, provisional certifications, are those common in medical practices?
Actually, they have different names. Some call them temporary licenses. Many of the allied sciences like physical therapy, occupational therapy have, and the board can, the members can speak to, or the panel can speak to this, have eliminated those kind of temporary licenses and just offer full licensure to the clinicians. Once a clinician has graduated from an accredited program, met all the standards of that program, have passed in many instances a board certification that is, board examination that is required by their professional entities, those are full licensure, and most places have moved away from temporary licensure. And I'll yield to the panel to see if I've given an accurate response.
Thank you, Senator Watson. No, that is correct. Most boards have strayed from that. And I think right now we have approximately 7 or 8 of our 38 health-related boards that offer a temporary or provisional license.
And the key factor on this one is that, for those of us that are in healthcare, Medicare pays probably about 65 to 70% of the charges that hospitals and other entities will incur or will charge patients. And oftentimes, once Medicare makes a definitional decision about something, everything starts to move in that direction. And so with Medicare now recognizing or not recognizing provisional licenses as being full, and the definition here is full license. And again, I'll yield to the panel to clarify for me. But when a person graduates and takes the board examination, they have licensure in the state of Tennessee, but by creating this provisional licensure, Medicare looks at that and says, you do not have full licensure. So the question that I would have for the panel is, does the state of Tennessee provide licensure to an individual after they have created the provisional licensing period that ASHA requires, or are they provided a state license upon completion of the program and pass of their examination?
Thank you, Chairman. I think I understand your question. If they're choosing to use the ASHA path for licensure, they're not granted a full license by the state until they complete that program. They are granted a temporary license if they're beginning to complete that program through ASHA, but until they're certified by ASHA, they are not granted a full license by the board.
And I'm sorry, Mr. Chairman, for going on, and I'll just, but in reality, every speech and language pathologist has to go through the ASHA provisional licensing, correct?
The other path would be if they hold a doctor of audiology from an accredited institution of higher learning.
Well, but speech pathologists are not audiologists. Audiologists do hearing. Speech pathologists do speech and swallowing and language. And so, again, the reality of it is the only path for a speech and language pathology is they have to pay a third party for permission to practice a profession that the state of Tennessee has said, if you meet these requirements, you're licensed to practice in the state of Tennessee. Lack of doing that creates a situation where a person has a limited license because it's provisional, and that's why the Medicare has come back and said, we're not going to reimburse entities that are using provisional license because they have not achieved full licensure in their state. It's not for me, Mr. Chairman, as a non-member of this committee, to make recommendations as to the continuation or suspension of a board. But I would ask upon my members that they consider that as they look at extending this board, having this board respond to this interrogatory, board members respond to this interrogatory in a way that helps us make the path for speech and language pathologists less expensive. I mean, it costs $250. What's the licensing fee in Tennessee for a speech language pathology? I know it's in your papers. I just can't remember.
Jennifer Putnam, the initial application fee is $50, and then your initial licensure fee is $100. The renewal fee is $120.
Okay, so roughly a speech language pathologist seeking licensure in the state of Tennessee would first pay $250 to an independent entity of the state of Tennessee, of which we have no control, no say about. And then on top of that, then they pay the state of Tennessee somewhere between $100 and $150. So SLPs in the state of Tennessee are being taxed or being asked to pay two fees, one that is not even associated with the state of Tennessee other than through just statutory language. And I would ask that the committee take that into consideration as they consider what they want to do with this particular board. And I'll yield.
Thank you, Chairman. And again, we're happy to continue to talk with you and other members about the statute. The board is following the statute as it's written, and but we're more than happy to discuss the best path forward for this profession. The board, I'll just say the board is following the statute. We'd be happy to work with you and happy to get some committee members engaged in that conversation as well.
All right. Thank you, Mr. Chairman, and the indulgence of the committee.
All right. Rep. McKenzie, you're recognized.
Thank you, Mr. Chair. And I really appreciate this conversation. I'm learning a lot. I guess as I kind of play devil's advocate, as I think about it, with us being such a call it friendly state with so many bordering states touching us, if we did something like that, basically doing away with the nationwide accreditation, or whatever you want to call it, and only having the state, how would that affect places like Clarksville or Chattanooga that have these, half a block down the road, you're in Georgia or Kentucky, and they probably deal with a lot of patients from that area. So how would that work?
That's a great question. And we're continuing to look into this. When Chairman Watson brought this to our attention yesterday, we're continuing to look into it. And it's actually the next item on the agenda is actually a licensure compact that's in the midst of being created. And so that'll certainly have to be a part of the conversation.
Thank you.
All right. Thank you. Any further questions from our committee? Rep. Fritz, you are recognized.
Thank you, Mr. Chairman. And just to follow up to this conversation, could we remain in requirements of statute and remove the state fee so that practitioner is not paying two fees
I think
for an interstitial period so that we wouldn't be penalizing with what the senator described as paying twice?
The board has the authority to adjust the fees. They are currently self-sufficient, so we would not want to do something that would require them to not become self-sufficient in the future. So we would have to look at that holistically, but the board has the authority to change their fees.
Rep. Fritz, is that it? All right. Thank you. Any other questions from our committee? All right. Any questions or comments, or any comments from our audience? All right, seeing none, let me just say before we entertain a motion, Chairman Watson, I appreciate you bringing, enlightening us on the agenda. I think what we need to do is just go ahead and extend this committee, and then we'll just hold it until the end of session, depending on how they respond, and we can, because this is just going to the full committee anyway. It's just a recommendation. So with that, there's not objection. Do we have a motion? Chairman Jackson.
Thank you, Mr. Chairman. And make a motion for the Board of Commission and Disorders and Tennessee Council on Autism Spectrum. Board of Communication Disorders and Sciences for 5 years to 2031.
Thank you, Chairman. Do I have a second? Second. I have a motion second. Any objection to the question? Seeing none. Madam Clerk, please take the roll call in the Senate.
Senator Crow votes aye. Senator Jackson votes aye. Senator Oliver, Senator Seal votes aye. Senator Sutherland votes aye. Chairman Rose
Aye.
votes aye.
All right. All in favor in the House, please say aye. And opposed? Ayes have it. Moves forward with a 5-year extension. Chairman Watson, again, thank you for being with us today. Are you going to be here for the next presentation? Very good. All right. All right. Mr. Witt, Ms. Putnam, you go proceed.
Thank you, Chairman. Again, Holt Witt, Assistant Commissioner for Legislative Affairs, and Jennifer Putnam, Assistant Commissioner for Health Licensure and Regulation. And Mr. Varnell is also assisting with the compact that is currently being organized. And I'll turn it over to Jennifer for further explanation.
Thank you. The Audiology and Speech Language Pathology Compact is a formal agreement among states to facilitate interstate practice. Under this compact, licensees who are in good standing in a compact member state may also practice in another compact member state via a compact privilege, which is equivalent to a license. The commission is still in the development phase of creating its bylaws. There are monthly meetings, with the next meeting scheduled for June 30th. It is anticipated that the commission will have their application system ready by fall of 2025. Chairman, that concludes our initial presentation, and we're happy to answer any questions you may have.
Thank you so much. Any questions from our committee? Rep. Fritz, you sure you don't want to ask a question on this one? You're good right now? All right, Chairman Watson, I believe you had a question.
Yeah, I have one question. I'm not sure the panel can answer it. The attorney might be able to answer it. And I may have carried the legislation for the compact for speech and language pathologists. And this is actually a question that's not only state related, but it's also nationally related because of the compact. We just had a discussion about the CCC, the Certificate for Clinical Competency. This question is asked by speech pathologists across the country as they look at the compact. Is the CCC, the Certificate of Clinical Competency, required for membership in the compact?
Thank you for the question. I don't know right off, but I'll be happy to look into that and get back with you and follow up.
Nationally, there is lack of clarity on that question. And to the members, the previous discussion, with the exception of North Dakota, every state has this provisional licensure thing. So every state is now going through this conversation, especially with the Medicare ruling. So if you could ask the board to respond to that question about the CCC in writing to me or to the chairman, I suppose, of this committee would be the appropriate person on whether the CCC is a requirement for membership in the compact.
Yes, sir, Chairman. And I imagine, given the recent news from CMS, that'll be a topic of conversation as well at the June 30th meeting. Thank you.
Thank you.
All right, again, Chairman Jackson, Watson, thank you for the question. And Mr. Wade, if you would, just send that to me and I'll disseminate that to the committee, please. And go ahead and CC Chairman Watson on that.
Yes, sir.
Very good. All right. Any further questions from our committee? Any public comments? All right. Seeing none, we'll entertain it. Chairman Jackson, you're recognized.
Thank you, Mr. Chairman. I'd make a motion for the audiology, speech, pathology, and interstate compact for 8 years to 2034.
All right. We have a motion. We have a second.
Second.
We have a second. Motion second. Any objections to the vote? Seeing none, Madam Clerk, please take a roll call vote in the Senate.
Senator Crowe votes yes. Senator Jackson votes aye. Senator Oliver, Senator Seal votes aye. Senator Sutherland votes aye. Chairman Rose
Aye.
votes aye.
All in favor in the House, please say aye. And opposed? Moves forward with an 8-year extension. Thank you so much for being here. You are recognized for the Board of Chiropractic Examiners.
Thank you, Chairman and members. Again, for the record, I am Holt Witt, Assistant Commissioner for Legislative Affairs of the Department, joined by Jennifer Putnam, Assistant Commissioner for Health Licensure and Regulation, and Mr. Michael Varnell also serves as the advisory attorney for the Board of Chiropractic Examiners. I will turn it over to Ms. Putnam for further explanation.
Thank you. The Board of Chiropractic Examiners was established in 1923 to regulate the practice of chiropractic and chiropractic x-ray. Currently, there are roughly 2,000 practitioners that are licensed by this board. Now, in addition to issuing those licenses, this board also promulgates rules, investigates complaints, and handles disciplinary matters. The board has 7 members, all appointed by the governor, and they meet 4 times a year. Currently, there are 2 positions that have expired, with those members continuing to serve until a successor is appointed. Those positions are currently in the appointment process in the governor's office. This board is self-sufficient, and we're happy to answer any questions the committee may have.
All right. Thank you, Ms. Putnam. Do we have any questions from our committee? Any public comments? All right. Seeing none, do I have a motion? Chairman Crawford.
Thank you, Mr. Chairman. I make a motion that the Board of Chiropractic Examiners be extended for 5 years to 2031.
All right. Do we have a second? Got a second. Thank you so much. No objection to the vote. Madam Clerk, please take the roll call vote in the Senate.
Senator Crowe. Senator Jackson. Votes aye. Senator Oliver. Senator Seal. Votes aye. Senator Sutherland. Votes aye. Chairman Rose.
Aye.
Votes aye.
Chairman Crowe.
Chairman Crowe.
There you
Votes
go.
aye.
All right, thank you. In the House, all in favor, please say aye.
Aye.
And opposed? All right, moves forward with a 5-year extension. Thank you so much. Mr. Witt, you're recognized Board of Dentistry.
Thank you. Thank you, Chairman. Holt Witt, Assistant Commissioner for Legislative Affairs, joined by Jennifer Putnam, Assistant Commissioner for Health Licensure and Regulation. We also have Ashley Fine here from the Office General Counsel, who assists the board. I'll turn it over to Ms. Putnam for further explanation.
All right, you're recognized. Go ahead.
Thank you, Chairman. The Board of Dentistry was established in 1957 to regulate the practice of dentistry. Currently, there are over 22,000 professionals that are licensed by this board. Like our other boards, this board also promulgates rules, investigates complaints, and handles disciplinary matters. There are 11 members on this board, all appointed by the governor, and they meet 4 times a year. Currently, there are 6 positions that have expired, with those members continuing to serve until a successor is appointed. Those positions are in the appointment process to be filled by the governor. This board is self-sufficient, and we're happy to answer any questions the committee has.
Ms. Putnam, thank you so much. Any questions from our committee? Any public comments? All right, seeing none, I'll entertain the motion. Chairman Jackson, you're recognized.
Thank you, Mr. Chairman, and I make a motion for the Board of Dentistry for a 5-year extension to 2031.
All right, thank you. Do we have a second? Thank you, Ms. Rutter. Appreciate that. All right, no opposition to the vote. Madam Clerk, please take the vote. Roll call vote in the Senate.
Senator Crowe. Votes aye. Senator Jackson. Votes aye. Senator Oliver. Senator Seal. Votes aye. Senator Sutherland. Votes aye. Chairman Rose.
Aye.
Votes aye.
All right, all in the House, please say aye in favor. And opposed? No. All right, moves forward a 5-year extension. You are recognized for the Board of Dispensing Opticians. Mr. Holt and Ms. Putnam, I'm not sure who's doing this one.
Sure. Thank you, Chairman. Again, for the record, Holt Witt and Jennifer Putnam. We also have Kathy Trawick from the Office of General Counsel and Mr. Jonathan Wingrad, who serves on the board. I will turn it over to Ms. Putnam for further explanation about the Board of Dispensing Opticians.
You're recognized.
Thank you. This board was established in 1955 to regulate the practice of opticianry. Currently, there are 1,000 professionals that are licensed by this board. Such as our other boards, this board also promulgates rules, investigates complaints, and handles disciplinary matters. Currently, the board has 6 members, all of which are appointed by the governor, and they meet 4 times a year. There is 1 vacancy and 2 positions that have expired, with those members continuing to serve until a successor is appointed. Those positions are currently in the appointment process to be filled by the governor. This board is also self-sufficient, and we're happy to answer any questions the committee may have.
Thank you, Ms. Putnam. Any questions from our committee? Any public comment? All right, seeing none, we'll entertain a motion. Chairman Jackson, you're recognized.
Sorry, my speaker. Thank you, Mr. Chairman. I make a motion for the Board of Dispensing Opticians for 5 years to 2031.
All right, we got a motion. Do we have a second? Thank you. All right. Without objection to the vote, Madam Clerk, please take the roll call vote in the Senate.
Senator Crowe. Votes aye. Senator Jackson. Votes aye. Senator Oliver. Senator Seal. Votes aye. Senator Sutherland. Votes aye. Chairman Rose.
Aye.
Votes aye.
All in favor in the House, please say aye. And opposed? Ayes have it. Moves forward with 5-year extension. Thank you so much. You are recognized for the Board of Examiners in Psychology. Mr. Witt.
Thank you, Chairman. Again, for the record, Holt Witt, joined by Jennifer Putnam, Assistant Commissioner for Health Licensure and Regulation. And we also have Kathy Trawick from the Office of General Counsel for the Board of Psychology as well. I'll turn it over to Ms. Putnam for further explanation.
You are recognized. Go ahead.
Thank you, Chairman. This board was established in 1953 to regulate the practice of psychology. Currently, there are 2,000 professionals that are licensed by this board. In addition to issuing those licenses, this board also promulgates rules, investigates complaints, and handles disciplinary matters. The board has 10 members, all appointed by the governor, and meets 4 times a year. Currently, there is 1 vacancy and 2 positions that have expired, with those members continuing to serve until a successor is appointed. Those positions are currently in the governor's office to be filled. This board is also self-sufficient, and we're happy to answer any questions.
All right, thank you so much. Any questions from our committee? Rep. Fritz, you're recognized.
Thank you, Mr. Chairman. Thank you all again for your time. I didn't see anything about counseling professionals. Is this simply to psychologists, or does it extend into the counseling profession?
No, so that's a good question. This board licenses psychologists, senior psychological examiners, and then psychological assistants. So that's a separate board that licenses counselors.
You're welcome. Any further questions from our committee? Any public comment? All right, seeing none, we'll entertain a motion. Representative Chairman Crawford, you're recognized.
Thank you, Mr. Chairman. I make a motion that the Board of Examiners in Psychology be extended for 5 years into 2031.
Thank you. We have a motion. We have a second. Thank you so much. Appreciate it. Any objections to vote? Seeing none, take the roll call, Madam Clerk, and the Senate, please.
Senator Crowe. Votes aye. Senator Jackson. Votes aye. Senator Oliver. Senator Seal. Votes aye. Senator Sutherland. Votes aye. Chairman Rose.
Aye.
Votes aye.
All right, in the House, all in favor, please say aye. And opposed? Ayes have it. Moves forward with a 5-year extension. Mr. Witt, you are recognized to present on the Board of Podiatric Medical Examiners.
Thank you, Chairman. Again, for the record, my name is Holt Witt, Assistant Commissioner for Legislative Affairs. I'm joined by Jennifer Putnam, Assistant Commissioner for Health Licensure and Regulation. Also joined by Ashley Fine from the Office of General Counsel, who advises the board. I'll turn it over to Ms. Putnam again for further explanation.
You're recognized, Ms. Putnam.
Thank you, Chairman. This board was established in 1931 to regulate the practice of podiatry. Currently, there are 800 professionals that are licensed by this board. In addition to issuing those licenses, this board promulgates rules, investigates complaints, and handles disciplinary matters. The board has 6 members, all appointed by the governor, and meets 4 times a year. Currently, there is 1 vacancy due to a resignation, and that position is currently in the appointment process to be filled by the governor. This board is self-sufficient, and we're happy to answer any questions.
All right, thank you. Any questions from our committee? All right, any public comments? All right, seeing none, we'll entertain a motion. Chairman Crawford.
Thank you, Mr. Chairman. I make a motion that the Board of Podiatric Medical Examiners be extended for 5 years into 2031.
Thank you, sir. Do we have a second? Thank you, Ms. Rudder. Appreciate that. Any objections to vote? Seeing none, Madam Clerk, please take the roll call vote in the Senate.
Senator Crowe. Votes aye. Senator Jackson. Votes aye. Senator Oliver. Senator Seal. Votes aye. Senator Sutherland. Votes aye. Chairman Rose.
Aye.
Votes aye.
All right, take a voice vote in the House. All in favor, please say aye. Aye. And opposed? Ayes have it. Moves forward with a 5-year extension. You are recognized, Mr. Witt, for the Board of Social Work Licensure.
Thank you, Chairman. Holt Witt, Assistant Commissioner for Legislative Affairs, joined by Jennifer Putnam, Assistant Commissioner for Health Licensure and Regulation, joined by Board Attorney Kathy Trawick from the Office of General Counsel. And we also have Ms. Angela Deloach, who serves on the board. Mrs. Putnam will offer further explanation.
Ms. Putnam, you're recognized.
Thank you, Chairman. This board was established in 1984 to regulate the practice of social work. Currently, there are 9,000 professionals that are licensed by this board. In addition to issuing those licenses, this board also promulgates rules, investigates complaints, and handles disciplinary matters. The board has 11 members, all appointed by the governor, and meets 4 times a year. Currently, there are 2 vacancies due to resignation. However, those positions are in the appointment process to be filled by the governor. This board is self-sufficient, and we're happy to answer any questions you may have.
All right, thank you. Representative Glenn, you're recognized.
Thank you, Mr. Chairman, and thank you all for being here. Quick question. Obviously, there is a shortage of social workers across the state. Does the board recommend any actions to try to help fill those vacancies?
I believe the board member may have some information for you, but not that I'm aware of currently.
And if you would, if you're going to respond to that, if you tell us who you are and make sure your mic's on.
Good morning. I'm Angela Deloach, a board member. It's very obvious there are social work vacancies all over. I'm a school social worker, so I know that very well. I know that I've served on the board for 2 years now, and I know that in the office, of the employees that process the applications and getting everything through. I know that they have been more efficient and able to get the applications processed very quickly now. So that used to be a barrier that I would hear about. As far as, people going into the role of social work, I really don't know. I mean, I know I service interns every year in school social work that come and intern under me. But it is a problem. I mean, it's a hard field to go into too.
Rep. Glenn, you're recognized.
Thank you, Mr. Chairman. So those interns that work under you, do they normally stay, or do they say, hey, this is more than I thought, and they leave the field?
It's about 50% for school social work. Some people really love school social work, but what comes in the other barrier is funding. In the district that I work in, I serve 4 different schools. I have a caseload of about 1,375 students. The recommendation for the American School Social Work Association is 250 per social worker. In my district, we have 2 social workers that serve full-time at our high schools because they are larger and we're in a rural county. And then 3 of us serve multiple schools. 2 of us serve 4 schools and 1 serves 5 schools.
How many did you say you serve?
1,375.
And you should have 250?
That's the recommendation.
Wow. Thank you, Mr. Chairman.
You're most welcome. Any further questions from our committee? Any public comments? Seeing none, I will entertain a motion. Chairman Jackson.
I make a motion for the Board of Social Work Legislature to licensure for a 5-year extension to 2031.
Thank you for the motion. Do we have a second? Chair Lady Rutter, I believe. We have a second. Thank you, sir. All right. Well, thank you so much. I appreciate that. All right. Any objection to the question, to the vote? Seeing none, Madam Clerk, please take the roll call vote in the Senate.
Senator Crowe votes aye. Senator Jackson votes aye. Senator Oliver, Senator Seal votes aye. Senator Sutherland votes aye. Chairman Rose
Aye.
votes aye.
All right. In the House, all in favor, please say aye. And opposed? Moves forward with a 5-year extension. Thank you so much. Mr. Witt, you are recognized to present on behalf of the Board of Veterinary Medical Examiners.
Thank you, Chairman. My name is Holt Witt, Assistant Commissioner for Legislative Affairs of the Department of Health, joined by Jennifer Putnam, Assistant Commissioner for Health Licensure and Regulation. With me, we have with us Rhonda Webb-Stewart, who serves in the Office of General Counsel for the board. Turn it over to Ms. Putnam for further explanation.
Ms. Putnam, you're recognized.
Thank you, Chairman. This board was established in 1905 to regulate the practice of veterinary medicine. Currently, there are approximately 6,000 professionals that are licensed by this board. In addition to issuing those licenses, this board also promulgates rules, investigates complaints, and handles disciplinary matters. The board has 7 members, all appointed by the governor, and meets 3 times a year. Currently, there is 1 vacancy due to a resignation and 1 position that has expired, with that member continuing to serve until a successor is appointed. Those positions are currently in the appointment process to be filled by the governor. This board is self-sufficient, and we're happy to answer any questions.
All right. Thank you. Any questions from our committee? Chairman Crowe.
Thank you, Mr. Chair. For the vacancy and then the one that's about to expire, what are the, are they grand divisional? What's the requirements for those appointments for the governor? Any
Sure.
special?
They're not special in regards to district. They're delineated out by the type of licensure. For example, veterinarian, veterinary tech. Again, the resignation was due to an individual that was moving. So we notified the governor's office, and they're in the process of vetting candidates for that position. And then the position that has expired, they are not only in the process of vetting potential new appointments, but also considering reappointment for the individual whose term has expired, as they're eligible to be reappointed.
Are those for veterinarians or veterinary techs, you know?
Yes, sir. They are for. Yeah, they're both for veterinarians.
Okay, thank you.
You're welcome. Any further questions from our committee? Any public comments? Seeing none, we'll entertain a motion. Chairman Jackson, you're recognized.
Thank you, Mr. Chairman, and I make a motion for the Board of Veterinary Medical Examiners for an extension of 5 years to 2031.
Thank you, Chairman Jack. Do I have a second? Chair Lady Rutter, thank you so much. Any objection to the vote? Seeing none, Madam Clerk, please take the roll call vote in the Senate.
Senator Crow. Votes aye. Senator Jackson. Votes aye. Senator Oliver. Senator Seal. Votes aye. Senator Sutherland. Votes aye. Chairman Rose.
Aye.
Votes aye.
All right, all in favor in the House, please say aye. And opposed? Moves forward with 5-year extension. Mr. Witt, you're recognized for the Committee for Clinical Perfusionist.
Thank you, Chairman. Again, for the record, Holt Witt, and joined by Jennifer Putnam. Also have Ashley Fine here from the Office of General Counsel, who serves in an advisory role for the committee. Mrs. Putnam will offer further explanation.
You're recognized, Ms. Putnam.
Thank you, Chairman. This committee was established in 1999 to regulate the practice of perfusion. Currently, there are 200 professionals that are licensed by this committee. In addition to issuing licenses, this committee also promulgates rules, investigates complaints, and handles disciplinary matters. The committee has 7 members, all appointed by the governor, and is required to meet annually or at the decision of the committee or the chair should there be a need. Currently, there are 2 vacancies and 1 position that has expired, with that member continuing to serve until a successor is appointed. Those positions are currently in the appointment process to be filled by the governor. This committee is self-sufficient, and we're happy to answer any questions.
All right, thank you. Chairman Jackson, you're recognized.
Yes, thank you, Mr. Chairman. I met with y'all yesterday and I learned something. What is a perfusionist? If you could tell us what that is, I would appreciate it, because I think several people probably don't know.
Thank you, Chairman. Yes, sir. A perfusionist operates operates machinery that operates the heart or lung when you're in the midst of a procedure, so that, if your heart or lung is not operating because they may be operating on your heart or lungs, they operate the machinery that keeps you alive during that procedure.
Thank you. Thank you, Mr. Chairman.
Chairman Jackson, thank you for that question. I Googled because I have no idea what a perfusionist was, but now that I know. Any further questions from our committee or comments? Any comments from public? All right, seeing none, no. Madam Clerk, please take, we have a motion. Chairman Jackson.
Thank you, Mr. Chairman, and I make a motion for the Committee for Clinical Perfusionists for extension of 5 years to 2031.
Thank you so much. We have a second. Chair Lady Rudder, thank you so much. All right, no objection vote. Madam Clerk, please take the roll call vote in the Senate.
Senator Crow. Votes aye. Senator Jackson. Votes aye. Senator Oliver. Senator Seal. Votes aye. Senator Sutherland. Votes aye. Chairman Rose.
Aye.
Votes aye.
Right. In the House, all in favor, please say aye. Aye. Opposed? Moves forward with 5-year extension. Thank you so much. I think you're getting close to the end, but you're not there yet. So, Mr. Witt, you're recognized for to present on the Professional Art Therapist Committee of the Board of Examiners in Psychology. That's a mouthful right there.
There we go. Again, for the record, Holt Witt, Assistant Commissioner for Legislative Affairs, joined by Jennifer Putnam, Assistant Commissioner for Health, Licensure, and Regulation. We also have Kathy Trawick from the Office of General Counsel and Board Member Catherine Harris. I'll turn it over to Ms. Putnam for further explanation.
Ms. Putnam, you're recognized.
Thank you, Chairman. This committee was established in 2022 to regulate the practice of art therapy. Currently, the committee is in the process of promulgating the rules, and licenses will be issued once those rules are promulgated. The board has 3 members, all appointed by the governor, and they meet 3 times a year. There are 2 positions that have expired, with those members continuing to serve until a successor has been appointed. Those positions are currently in the appointment process to be filled by the governor. Mr. Chairman, that concludes our presentation. We're happy to answer any questions you have.
Thank you. Any questions from our committee? Any public comments? All right, we will entertain a motion. Chairman Jackson, you're recognized.
Thank you, Mr. Chairman. And I make a motion for a Professional Art Therapist Advisory Committee for an extension of 5 years to 2031.
All right, thank you. Do I have a second? Chair Lady Rudder, thank you so much. All right, no objections vote. Madam Clerk, please take the roll call vote in the Senate.
Senator Crow. Votes aye. Senator Jackson. Votes aye. Senator Oliver. Senator Seal. Votes aye. Senator Sutherland. Votes aye. Chairman Rose.
Aye.
Votes aye.
All right, in the House, all in favor, please say aye. Aye. And opposed? Ayes have it. Moves forward with a 5-year extension. Thank you so much. Mr. Witt, you are recognized for the State Alzheimer's Disease and Related Dementia Advisory Council.
Thank you, Chairman, and members. Again, for the record, I'm Holt Witt, Assistant Commissioner for Legislative Affairs. I'm joined today by J.W. Randolph, Deputy Commissioner for Health Strategy and Regulation, Sally Pitt, who is the Director of the Office of Healthy Aging, and Ms. Joanne Bunn, who serves as CEO of Alzheimer's Association of Tennessee and is Chair of the Advisory Council. The Tennessee Alzheimer's Disease and Related Dementia Advisory Council was established in 2019 and was previously administratively attached to the Tennessee Commission on Aging and Disability. In 2024, Public Chapter 688 revised the framework of the council and transferred the administrative functions to the Department of Health. The council assesses the current and future impact of Alzheimer's disease and dementia on residents of the state, examines existing industry services and resources addressing the needs of the impacted persons, families, and caregivers, develops a strategy to mobilize a state response to matters regarding Alzheimer's and dementia-related diseases, and finally, it reports to the governor and to the General Assembly on issues related to its work, including a state action plan. The council currently has one vacancy, and the council does not have any expenditures or revenue. We'd be happy to answer any questions that y'all may have.
Thank you, Mr. Witt. Any questions from our committee? Any public comments? All right. Seeing none, we would entertain a motion to Representative Chairman Crawford, excuse me.
Thank you, Mr. Chairman. I make a motion that the State Alzheimer's Disease and Dementia Council be extended for 5 years into 2031.
Thank you. Do I have a second? Chair Lady Rudder, thank you so much. All right. No objections or questions? Madam Clerk, please take the roll call vote in the Senate.
Senator Crowe votes aye. Senator Jackson votes aye. Senator Oliver, Senator Seal votes aye. Senator Sutherland votes aye. Chairman Rose
Aye.
votes aye.
Thank you. All in favor in the House, please say aye. Aye. And opposed? Ayes have it. Moves forward with 5-year extension. I believe the last item we have, is that correct? Yep. Is occupational therapy licensure compact. Mr. Witt, you got one more?
Yes, sir, Chairman. One more.
All right, let's do it. You're recognized.
Thank you, sir. Again, for the record, Holt Witt, Assistant Commissioner for Legislative Affairs. I am joined again by Jennifer Putnam, Assistant Commissioner of Health Licensure and Regulation. Also joined by Mr. Michael Varnell, who serves in an advisory role for the compact. And we have Mr. James Claxton with us as well, who is a board member for the OT board. I'm going to turn it over to Ms. Putnam one last time for further explanation.
Ms. Putnam, you are recognized.
Thank you, Chairman. The Occupational Licensure Therapy Compact is a formal agreement among states to facilitate interstate practice. Under the compact, licensees who are licensed in good state in a compact member state may practice in other compact member states via a compact privilege, which is equivalent to a license. The commission is still in the development phase of creating its bylaws. There are monthly meetings scheduled, and it is anticipated that the commission will have the application system up and running by fall of 2025. That concludes our initial presentation. We're happy to answer any questions you have.
All right, thank you. Any questions from our committee? Representative McKenzie, you're recognized.
Thank you, Mr. Chair. Just a quick question. How many states are currently part of the compact, and is there any, what's the ultimate goal, if you know that?
Now there are approximately 25 that have entered into the compact.
Thank you.
Thank you. Any further questions from the committee? Any public comment? Seeing none, we'll entertain a motion. Chairman Jackson, you're recognized.
Thank you, Mr. Chairman, and I make a motion for the Occupational Therapy Licensure Compact for an extension of 8 years to 2034.
Thank you, Chairman. Do we have a second? Thank you, Chair Lady Rudder. Any objection to the vote? Seeing none, Madam Clerk, please take the roll call vote in the Senate.
Senator Crowe votes aye. Senator Jackson votes aye. Senator Oliver, Senator Seal votes aye. Senator Sutherland votes aye. Chairman Rose. Chairman Rose.
Aye.
Aye. Votes aye.
Sorry. I was being interrupted up here. I'm sorry about that. We'll take a voice vote in the House. All in favor, please say aye. Aye. And opposed? Moves forward with 8-year extension. Thank you so much for being here. You guys did a great job. Let me conclude our meeting with this comment. Actions by this joint committee are submitted to the Government Operations Committee for I'll say it in a minute, deliberation and final decision prior to being placed on the calendar during legislative session. Notice future meetings would be posted in advance of scheduled meetings. Remind everyone that we have rule review this afternoon at 1 o'clock, and it will be in House Hearing Room 3. One. Well, it says 3.
That's what I was telling you.
I wasn't listening. House hearing room 1. Right. Thank you all. Committee, thank you for being here. Great job today. We got through this pretty quickly.